Hi, it's Patrick Hutzel from intensivecarehotline.com with another episode of Your Questions Answered. This week, Sarah from London in the United Kingdom writes in. Hi Patrick, my 66-year-old husband has been admitted to intensive care and he is on full life support. He fell off the ladder while repairing our roof of the house and unfortunately he fell straight onto his head. The damage done to his head, and more importantly the damage done to his brain, are so severe that me and my two daughters have been told by the intensive care team that the chances of recovery and the chances of survival are very slim and that we should brace for him to die in the next couple of days. Apparently he sustained a really severe bleed into his brain from the fall, and the head trauma and the bleed in his brain is causing severe brain damage. Me and my daughters are feeling very distressed about my husband's accident as it happened out of the blue. My husband and I just retired in the last year and we were looking forward to a better and quieter life with more time for each other and more time for the family. To make matters worse, me and my daughters feel that we are pressured to accept and also to agree that the intensive care team can withdraw life support from my husband so that he can die. We are still so shocked, stressed and overwhelmed by the whole experience that we are not ready to let him go and we want more time with him. We also feel like one senior doctor in particular is not able to empathize with our feelings at all, and all he keeps going on about is how sick my husband is and how poor his prognosis is. He just doesn't seem to care that we want more time with him. We do understand how sick he is and we do understand that he is probably going to die, but we are just not ready as yet and we want peace of mind. Furthermore, my husband's brother, to whom my husband is very close with, is living overseas and he is currently on a plane to fly in, and he doesn't want his brother to die without him being there. Can you please give us advice on how to handle this situation so that we can get to spend more time with my husband? Hi Sarah, thank you for your questions, and I'm very sad to hear that your husband is so sick and is a patient in intensive care. To me, Sarah, it sounds like your husband has sustained a really bad and nasty head and brain injury. Brain and head injuries are really bad, and the brain is usually the only organ that human medicine is unable to control. All other organs can be controlled, at least temporarily, in intensive care. This is unfortunately not the case with the brain. There is no equipment, technology or other clever inventions that can take over the function of the brain. It also sounds to me like you are not questioning the clinical facts, which is a good starting point, as it sounds to me like your husband is unfortunately so sick and unwell that he's going to pass away soon after life support has been withdrawn. In order for you and your two daughters to take control of the situation and get the outcome you want, which sounds to me like you want more time with your husband before you let him go, which would then give you more peace of mind, you need to address the following. Number 1. Ask the senior doctor whether he wants to have an empty bed in the intensive care unit for another patient to be admitted, as it could well be the case that the intensive care unit is very likely experiencing a lot of pressure on their beds, and there are more admissions waiting for the currently occupied intensive care bed. What is most likely also be the case is that the senior doctor you referred to is doing the maths in his head, and he might think that every day the ICU bed is occupied with a patient that is most likely going to die is costing around $4,000 to $5,000 a day, coming out of the intensive care unit's budget that could be used for other patients. That shouldn't concern you in any way, but you need to know and understand what is most likely going on in the background, so that you understand the most likely dynamics behind the decisions that are being made. This is very important for you to know in your situation, and don't be hesitant to ask those distinct questions, and don't be hesitant to challenge the intensive care team if you feel like you are not getting heard. It's also inappropriate that you feel like you are not getting the time you want and need with your husband that would give you more peace of mind. It's also important that you let the intensive care team know that you are waiting for your husband's brother and that you wish him to be there when your husband is passing away. Some intensive care units are very good when it comes to end-of-life care, and other intensive care units still have room for improvement when it comes to end-of-life care. It sounds to me like your husband has been admitted to an intensive care unit that has lots of room for improvement in the domain of end-of-life care. It is therefore even more important for you to challenge the intensive care team. Many, if not most intensive care units would accommodate your wishes regarding your husband's end-of-life situation, and they would happily give you and your family the time in order to come to terms with your difficult situation. It also sounds to me like you and your family have accepted the clinical facts that your husband is going to approach his end of life. However, if you still don't have peace of mind, just go and ask for a second opinion from either another intensive care consultant or maybe from a neurologist or a neurosurgeon. They often have a very differing view from the intensive care team, as their prime interest is not so much what is happening in intensive care. Their interests are usually very specific to the brain, and they may offer you different points of view, also regarding your husband's end-of-life situation. If you go out there and ask for other opinions, you might also get the time you need for you and for your family to come to terms with your husband's situation, and you and your family may find that critical peace of mind. I hope that answers this very common question that I get all the time. And if you have any further questions, please send your questions to support@intensivecarehotline.com. Also, in order to learn quickly how you can take control, have real power and influence decision making while your loved one is critically ill in intensive care, enter your email below and get your free instant impact report so that you can learn instantly what you need to do in order to take control of the situation. With the free instant impact report also come another 4 free reports. 6 questions you need to ask the most senior doctor in intensive care, the 7 most frequently asked questions, and the 7 answers to those 7 most frequently asked questions whilst your loved one is critically ill in intensive care. 10 things you didn't know doctors and nurses are talking about while your loved one is critically ill in intensive care, and 9 myths of being a critically ill patient in intensive care. Thank you for watching Your Questions Answered episode, and I'll see you again next week. This is Patrick Hutzel from intensivecarehotline.com.